A phlebotomist is preparing to draw blood from a patient who reports recent mastectomy on the right side. The most appropriate action is to use A. Right arm with a butterfly needle. B. Left arm using standard venipuncture. C. Right arm with a finger stick. D. Any site, as long as the tourniquet is loose. Answer B. Blood draws should not be done on the side of a mastectomy because lymph nodes may be damaged, increasing infection and lymphedema risk. The left arm is the safest and most appropriate choice. A specimen for ammonia testing must be handled in which special way? A. Collected in an amber tube. B. Placed on ice immediately. C. Warmed for 30 minutes. D. Kept at room temperature. Answer B. Ammonia levels degrade quickly unless kept cold. Placing the specimen on ice immediately stabilizes the analyte and ensures accurate testing. A patient begins sweating, becoming pale, and complains of dizziness during venipuncture. What should the phlebotomist do first? A. Continue the draw quickly. B. Elevate the patient's legs. C. Stop the draw and protect from falling. D. Offer the patient water. Answer C. These are signs of an impending syncope, fainting. The draw must be stopped immediately to prevent injury and ensure patient safety. Which needle gauge is most appropriate for collecting blood cultures in adults? A. 30 gauge. B. 25 gauge. C. 21 gauge. D. 18 gauge. Answer C. A 21 gauge needle provides sufficient lumen size to avoid hemolysis and ensures adequate blood flow for culture bottles without damaging cells. Which tube should be collected first when drawing blood cultures? A. Aerobic. B. Anaerobic. C. SST. D. Heparin. Answer A. Aerobic bottles need oxygen. Collecting them first prevents contamination and ensures accurate results. A specimen for lactic acid must be collected under which condition? A. Patient should be fasting. B. Without applying a tourniquet. C. Using capillary collection. D. After the patient exercises. Answer B. Tourniquets increase lactate levels by trapping blood, giving falsely elevated results. Lactic acid should be drawn without stasis. Which action most increases the risk of hemolysis? A. Gently inverting tubes. B. Using a large needle. C. Shaking tubes vigorously. D. Allowing alcohol to dry. Answer C. Vigorous shaking destroys red blood cells, causing hemolysis, which interferes with many laboratory tests. Which vein is generally considered the safest and most preferred site for routine venipuncture? A. Basilic vein. B. Dorsal hand veins. C. Median cubital vein. D. Femoral vein. Answer C. The median cubital vein is stable, easy to access, and has the lowest risk of nerve or arterial injury. A specimen requiring protection from light should be collected in which way? A. Wrapped in foil. B. Chilled immediately. C. Collected in a purple tube. D. Left uncapped. Answer A. Light-sensitive analytes such as bilirubin degrade in light. Wrapping in foil preserves integrity. A phlebotomist punctures through the vein causing a hematoma. The first response should be A. Continue the draw slowly. B. Remove the needle and apply pressure. C. Apply heat to the site. D. Massage the area. Answer B. A hematoma forms due to blood leaking into tissue. Removing the needle and applying pressure stops the bleeding. Which tube contains an anticoagulant that binds calcium? A. Light blue. B. Red. C. SST. D. Gray. Answer A. Light blue tubes contain sodium citrate, which binds calcium to prevent clotting. A patient on IV therapy must have blood drawn. The best option is to A. Draw above the 4. B. Draw below the 4 after 2 minutes. C. Draw from the 4 line. D. Turn off the 4 for 10 seconds. Answer B. Drawing below the 4 after allowing fluids to clear reduces contamination from infused solutions. Which test is most affected by prolonged tourniquet application? A. Sodium. B. Potassium. C. Glucose. D. Cholesterol. Answer B. Prolonged stasis causes potassium to leak from cells, falsely elevating levels. When performing capillary collection on an infant, the puncture depth should not exceed A. 2.0 mm. B. 3.0 mm. C. 4.5 mm. D. 5.0 mm. Answer A. Deeper punctures risk bone contact, infection, and osteomyelitis. Which is the correct order of draw for venipuncture? A. SST blue-green lavender. B. Blue-red-green lavender. C. Lavender blue-red-gray. D. Green SST lavender blue. Answer B. Light blue must come before serum and plasma tubes to ensure accurate coagulation studies. The most critical step in specimen collection is A. Selecting the vein. B. Applying the tourniquet. C. Identifying the patient. D. Labeling the tubes. Answer C. Proper identification prevents life-threatening errors, including misdiagnosis and mistreatment. A lipid panel requires the patient to be A. Fasting 8 to 12 hours. B. Lying supine. C. Hydrated with 2 liters of water. D. Standing for 30 minutes. Answer A. Triglycerides are highly affected by food intake, requiring fasting for accurate results. A phlebotomist should reject a specimen if A. The tube is half full. B. The tube is unlabeled. C. There is a small clot. D. The label is crooked. Answer B. Unlabeled specimens pose a major safety risk and cannot be processed. What is the purpose of inverting tubes? A. Preventing air bubbles. B. Removing debris. C. Increasing sample volume. D. Mixing additives with the specimen. Answer D. Proper mixing prevents microclots, ensuring sample integrity. During venipuncture, the needle should be inserted at A. 5 to 10 degrees. B. 15 to 30 degrees. C. 40 to 45 degrees. D. 60 degrees. Answer B. This angle allows smooth entry into the vein without puncturing through it. Which patient position is safest for a history of fainting? A. Standing. B. Seated. C. Reclining. D. Leaning forward. Answer C. A reclined position minimizes risk of falling if syncope occurs. Which tube is required for CBC testing? A. Green. B. Lavender. C. Red. D. Gray. Answer B. Lavender tubes contain EDTA, which preserves cell morphology for hematology testing. When collecting for troponin levels, timely transport is crucial because A. Troponin evaporates. B. Levels change rapidly after cardiac injury. C. Light destroys troponin. D. It clots very slowly. Answer, B. Troponin rises quickly in myocardial infarction, so delays affect diagnosis. A patient refuses a draw. The phlebotomist must A. Continue the draw. B. Restrain the patient. C. Notify the nurse and document. D. Convince the patient aggressively. Answer, C. Competent adults have the legal right to refuse. Proper reporting is required. A sample for blood alcohol testing should be cleaned with A. Alcohol pad. B. Iodine or soap and water. C. Bleach. D. Acetone. Answer, B. Alcohol pads contaminate results. Iodine or soap avoids false elevations. Fasting glucose is most affected when the patient A. Chews gum. B. Drinks black coffee. C. Walks briskly. D. Eats candy 1 hour before. Answer, D. Carbohydrates elevate blood glucose significantly, altering results. The safest heel puncture site for infants is A. Center of heel. B. Posterior curvature. C. Medial or lateral plantar surface. D. Arch of foot. Answer, C. This area avoids nerves and bone, reducing risk of injury. A specimen for ESR should be collected in a tube with A. Sodium heparin. B. EDTA. C. Oxalate. D. No additive. Answer, B. ESR testing requires EDTA to prevent clotting and maintain cell suspension. A delay in centrifugal separation causes A. Hemoconcentration. B. Hemolysis. C. Glucose consumption by cells. D. Increased platelets. Answer, C. Blood cells metabolize glucose, lowering levels over time unless separated. Which situation requires using a syringe draw? A. Fragile veins. B. Large median vein. C. Need for fast collection. D. Pediatric heel sticks. Answer, A. Syringes allow gentle pressure, preventing vein collapse in fragile veins. When a patient is on anticoagulants, the phlebotomist should A. Use smaller needles. B. Apply pressure for a longer time. C. Avoid venipuncture. D. Use a tourniquet for 3 minutes. Answer, B. Anticoagulants delay clotting, requiring extended pressure to prevent bleeding. Which tube is used for stat electrolytes? A. Lavender. B. Green. C. Red. D. Light blue. Answer, B. Green tubes contain heparin, producing rapid plasma samples for stat chemistry. Which condition requires airborne precautions? A. Influenza. B. MRSA. C. Tuberculosis. D. C. Difficile. Answer, C. TB spreads through airborne particles, requiring N95 masks and isolation. A patient asks for test results. The phlebotomist should A. Provide the results. B. Explain the meaning of results. C. Direct the patient to the physician. D. Ignore the request. Answer, C. Only licensed providers may interpret or disclose laboratory results. Which test must be drawn before the patient receives medication? A. HCG. B. Trough levels. C. CBC. D. ABO typing. Answer B. Trough levels measure lowest drug concentration and must be collected immediately before dosing. Which tube for heavy metal testing? A. Royal blue. B. Green. C. Gray. D. Lavender. Answer A. Royal blue tubes are trace element free, preventing contamination. What is the main purpose of the tourniquet? A. Stop bleeding. B. Increase venous filling. C. Prevent infection. D. Sterilize skin. Answer B. Tourniquets temporarily restrict venous return, making veins more prominent. A lipemic specimen appears. A. Clear. B. Yellow. C. Milky. D. Pink. Answer C. Excess lipids create a cloudy, milky appearance affecting certain tests. When collecting for blood cultures, the most critical step is A. Using a large needle. B. Proper skin antisepsis. C. Filling bottles quickly. D. Avoiding tourniquets. Answer B. Contamination causes false positives, therefore proper cleaning is essential. A specimen for coagulation testing should be rejected if A. Tube is underfilled. B. Tube is overfilled. C. Tube is inverted 5 times. D. Tube has air bubbles. Answer A. Underfilling alters the blood-to-additive ratio, leading to inaccurate clotting times. Which test should not be centrifuged? A. CBC. B. CMP. C. BMP. D. Lipase. Answer A. CBC requires whole blood, centrifugation separates cells, making analysis impossible. A phlebotomist must wash hands for at least A. 5 seconds. B. 10 seconds. C. 20 seconds. D. 40 seconds. Answer C. CDC guidelines recommend minimum 20 seconds for effective decontamination. Which action prevents hemoconcentration? A. Long tourniquet use. B. Pumping fist repeatedly. C. Releasing tourniquet once blood flows. D. Using small needles. Answer C. Releasing the tourniquet prevents blood pooling that alters test values. Which is the correct cleaning agent for arterial blood gas collection? A. Betadine. B. Alcohol and iodine. C. Soap only. D. Water only. Answer B. ABG collection requires strict antisepsis to avoid contamination and infection risk. A specimen for cross-match must be labeled with A. Patient initials. B. Room number. C. Full name and DOB. D. Insurance details. Answer C. Identification must be exact for safe blood transfusions. The purpose of the bevel on a needle is to A. Reduce pain during insertion. B. Increase blood flow pressure. C. Enhance tube vacuum. D. Prevent backflow. Answer A. The bevel creates a smooth entry point, reducing tissue trauma. What is the first step after a needle stick injury? A. Keep it secret. B. Continue working. C. Wash the area with soap and water. D. Apply ice. Answer: C. Immediate washing reduces exposure to blood-borne pathogens. A specimen for cortisol should be collected: A. In the morning. B. In the afternoon only. C. Anytime. D. After exercise. Answer: A. Cortisol follows a diurnal rhythm, peaking in the morning. Which factor most affects blood culture accuracy? A. Tube color. B. Patient weight. C. Volume of blood collected. D. Needle angle. Answer: C. Low volume decreases microorganism detection, reducing diagnostic accuracy. A phlebotomist drawing from a difficult vein should avoid: A. Repositioning slightly. B. Redirecting excessively. C. Using a butterfly. D. Asking for assistance. Answer: B. Excessive redirection increases trauma, causing hematomas and nerve injury.